Hello, I'm David Waite from Jubilee College, and today we're going to be doing hand reflexology. It's great for impromptu treatments, it's absolutely wonderful for first aid, and it's especially good if you've got a client that's got anxiety or if they've got emotional issues at all. Hand reflexology treatment can be done either face to face, if you kind of imagine that we've got a table between us. It can be done side by side. So if you've got a friend and they say, "Oh, I've got a terrible headache," and you're thinking, "Oh, come and give me your hands and I'll give you a bit of a treatment," and you can then work on your hands like this. It's also really good if you've got a client, if you imagine that they're lying in bed and you can't reach over to get to the feet, and that's going to give you really bad back, but you can do hand reflexology while they're lying in bed. What we're going to be doing today, though, is we're going to be working on our client in a Lafuma chair. So we're going to lean Helena back just here. And the first thing that we're going to do is to check her hands, have a look at her nails, make sure she hasn't got a fungal nail infection, but actually what she's got today is some gorgeous nails on, so there we go. Make sure they're nice and clean, and Halima washed her hands before we started here. So now we are good to go for a hand reflexology session. So, when we start a reflexology treatment, I like to check that the hands are okay, that they're clean, they've got no abrasions, no lesions, and there's no fungal nail infections. You can make sure everything's okay, that we can go ahead. So we're going to start by putting a little bit of lotion on, and then we're going to hold our client's hand. And this is a position that I like to call heart to heart, because my hand-heart reflex is now in touch with my client's. And we're just going to gently stroke, get the client used to the feel of touch. This will then just relax the client and get them ready for what we're going to do. And we're going to start with some finger pulls. As you can see, I'm pulling from right at the base of the hand, so that the whole of the thenar prominence and the finger is getting a nice pull. Move over to the next finger. Lovely, long, luscious pulls. Now we're going to take 2 fingers at a time so that we can get to the long finger. The pressure is actually coming onto the long finger, not onto the index finger at all really. But this way you can still get the pull right from the base of the hand. So we've swapped hands. Now onto the ring finger. Still keeping those long pulls all the way from the base of the hand. And now, onto the little finger. Just going to turn the hand over so you can see what I'm doing here. So you can see the principle of getting that really long, long pull. So now we're going to do finger rotations. Go back to the thumb. Rotating both ways. And we're holding the finger from the first joint. And this will give a feeling of security, but also of being able to get that mobility that you want in a nice finger pull. And finishing off with the little finger. Now we're going to do a wrist flex. Now it's important that when you're doing a wrist flex, that you don't have your hand in contact with the client's hand. You can see here that it's just my fingers interlocked with my client's fingers. This allows for the maximum amount of movement in the wrist. So we'll put a rotation on it now. So going right round and repeat. So we're going to do a palmar press. So
squeeze in and then squeeze off. So push in with the wrist, squeeze off with the holding hand. Then we're going to do something called breaking chocolate. I love teaching reflexology using cakes and sweets. So we're going to push the thumbs in and squeeze round. So we're making the palm of the hand just collapse with what we're doing, working from top to down. And now we're going to do the same thing, but with a different technique. So we're coming across with both the thenar prominence of the hands. The fingers are squeezing up underneath, and this really opens up the metacarpals nicely. I'm going to show you what we're doing by tilting the hand, showing the underneath view to this. So it's the same technique, so you can see it from both angles. And this just feels absolutely lovely. It really relaxes the hand nicely. What we're doing now is tapping the meridians, warming these up, as we have 6 meridians that run in each hand. Now then, we're going to squeeze on the start of the meridian points, and this is just squeezing either side of the nail bed. Tiny little rotation, just to activate the meridians. A little rotation just there. Squeeze on again. Squeeze on again. And squeeze on again. Now, because the meridian points go through the wrist, we're going to tap right the way around the wrist. Because there is a convergence of the meridians in the wrist. And then we go back to heart, just to finish off with a stroke. So we're going to work the metacarpals and open up the intercostal muscles. This is going to help with respiration. It's also brilliant for stress. And what we're doing is working 3 times for each line that we work between these metacarpal bones. As I push in with my 2 index fingers, I'm also pulling apart a little bit. So it's working down each side of the metacarpals. Now we move into a technique called the snow plough. If you imagine that you're pushing a load of snow in front of your fingers. And back down again. And as we get to the wrist, we press into the wrist joint. This is great for working areas that are suffering with oedema. So now I'm going to work between the thumb and the index finger, right up to the point where you can feel the 2 bones of the thumb and the index finger meet. Now this point that we get to, it is also the large intestine meridian point 4. Now this is contraindicated for pregnancy, but it is a fantastic reflex point for anybody suffering from pain, so you just get in there and have a good old roll around. So what we're doing now is the palmar aspect of the hand. So we're going to hold the hand flat. We want a nice flat canvas to work on. We're using the hand to create this flatness, and we're going to now work on the trapezius. Round circular motions as we push in. And we're going to push right into that trapezius muscle. And because we're working in a line, we're going to do 3 repetitions. So, good positive contact on the reflexes. So we're now going to work the respiratory system, so our lungs, which are found in the heads of the metacarpals here. You can see the line that I'm just working down to, the crease in the hand, that shows us where the diaphragm line is, so we're just working down as far as that. And again, because we're working on a line between these metacarpal heads, we're going to repeat it 3 times, just to make sure that we've got everything worked efficiently. And again, I'm putting a slight rotation on. You can see that sort of circular movement as I'm working down here. You can knuckle as well. And when you're knuckling, you want to use the corner of the knuckle. It creates a smaller surface area, which means you don't have to push so hard, but you still get that good positive contact. We're now going to do the diaphragm, and we're going to use the index finger for this, pulling back up towards ourselves underneath these metacarpal heads. You can see that as I walk along here with my finger, I'm placing my thumb on the fingers of my holding hand, and this allows me to create just 1 point of contact, which is really important so that the client knows exactly where you're working. And of course, you can knuckle if you wish. And this should create a lovely, satisfying, deep reflexology treatment. A good combination of fingers, thumbs and knuckles. I'm going to do the shoulder reflex now. And of course, if you want to, you can knuckle as well. Lovely sweep across that shoulder reflex. Very often crunchy, the shoulders are, showing signs of tension and stress and strain. This is a great way of working them out. And with the hands, it can be useful to bring the hands up into this position so that they are then copying the same shape that you would do with the feet. So you can now find the organs such as the liver, and you can locate them nice and easily. Pop your working finger or thumb on the reflex you want to work on, turn the hand back down, and you can now work away. The client will never guess that you had perhaps got a little lost or whatever, didn't know where the reflex was. They'll just think it's part of the treatment, but this makes working hands so much easier and can help if you get confused and lost. So we're going to work the liver. Again, a combination of thumb walking or knuckling, doesn't matter which. If you've got a very fleshy hand or a very firm hand, knuckling can always be a good idea. I'm going to work the gallbladder just here. And next we're going to work on the adrenal reflex, which is located just underneath the index finger just here. So the adrenals can often be quite sharp. Now onto the kidneys, moving slightly to the right just here, and you follow this line down, and that is the line that follows from the kidney to the bladder, so of course it's now our ureter. So we're going to work down here towards the bladder reflex, and again, because we're working a line, we do it 3 times, and I give plenty of attention to the bladder itself. Now we're going to work the heart reflex. It's found just here. This is known as the thenile prominence. I'm going to support my working hand by placing my holding hand underneath my client's hand. Just working across this. And when you think that the heart is a great big muscular organ, this is the biggest muscular area of the hand, it all starts to make sense when you think of the representations between the reflexes and the physical organs. One thing to remember as well when working on heart reflexes, whether it be the hands or the feet, is that we need to remember that the heart reflex isn't just the physical pump that pumps blood around the body. It's also the emotional centre of our being. And so if you have clients who are stressed, worried, anxious about situations, quite often we can find things on the heart reflex. We've also got the waistline guideline now. Runs along this area just here, so halfway across the heart to halfway to the metacarpal underneath the little finger. So now we know the area to work the small intestine, which is anywhere underneath the waistline guideline. And I always find working with the knuckles on the small intestine the easiest way to go. We don't have to work in any particular direction with the small intestine because of course it goes up and down and left and right, so just giving this thorough work over is absolutely fine. You can see me here using the corner of that index knuckle so I can get in a good treatment. So now we're going to work the ascending colon, and then we're going to work the transverse colon. So we've got the ileocecal valve just here, coming up halfway between these 2 points. That shows us where the hepatic flexure is. And then we move across halfway, and that then shows us where the colon would transverse across. Now we want to work the ileocecal valve first, and we want to work it in an upward motion. Last thing we want to do is to push any feces back from the ascending colon into the small intestine, as allergies can be stimulated if feces is passed back into the small intestine. We work along the transverse colon here. These allergies that I was talking about, this is caused by histamine. It's a chemical reaction that is created in the gut of feces getting into contact with digestive enzymes. And of course we all know what you take for allergies, which are antihistamines. So if we stop the histamines being created in the first place, we can really help our clients with allergies. We're going to work the spine now. So the cervical spine runs from the first joint of the thumb to where it joins the hand, just there. Then got the thoracic, which is the joint for here and there. And then we've got these next 2 points for the lumbar spine, and then sacrum and coccyx, these last 2 areas here. The technique that we're going to use for holding the client's hand is a handshake. The thumb rests really nicely between the first and second metacarpals, so it can be nicely isolated and you can apply good pressure to the cervical spine. What we're going to do is just press down, and then the holding hand rocks the client's hand underneath my working hand. So it's push in and rotate the other hand. Push in with my working hand, rotate with my holding hand. My thumb actually is just being moved by the movement of the rotation. So we do this all the way for the cervical and thoracic spine. Once we've got to the end of the thoracic spine, we're going to change. We're going to put some rotations on with my index finger. The index finger of my holding hand I'm just going to raise so that it clears the rest of the working area. And because we're working a line, we're going to do this 3 times. So start again, pushing in and rotating, pushing in with the working hand and rotating with the holding hand. And what you want to do is make sure that you are actually working on the bones of the hand. Don't work on the soft fleshy area of the hand. It's the bones that give the representation of the bony spine. So of course if you're not working on the bones, you're not actually working on the spine itself, of course. We'll do our last repetition, being as it's 3 times. Now, if you're used to counting the vertebrae on the feet, it's much more difficult to do that on the hands, purely because certain areas are so small, it's very difficult to get the accuracy that you can on the feet. So we would just work the spine rather than being specific on which vertebrae we were working. Now to finish the spine, we're going to hook on So this is hook work, pushing in, just as if pretend that your finger is a sewing needle and you're sewing through your client's hand. And that will then give you the technique that you're looking for. Onto the lumbar and the coccyx and sacrum. To finish the spine off, we're going to spread the spinal impulse. Working across the spine, we're using the soft area of the finger just here. This is not supposed to be hard or firm, this is just supposed to be a nice way to work. When you're working across the bottom, you want to work across the spine, not with the spine. So you're slightly changing your angle as you work across that base of the spine. So there we go. That is our spine done. The next reflexes we're going to work are the shoulders. We're going to work from the underside using the corner of our knuckle. We're going to sweep up, sweep, sweep again. Now I'm holding the hand at a very strange angle here. This is for your benefit, not for my client. Normally the hand would be palm down. And we're going to do knuckle circles down the arm and the leg reflexes. Because we're working a line, we'll do this 3 times. Circle nicely down the 5th metacarpal. And then what we're going to do is we're going to bring our other knuckle in, so working left and right knuckles together, working over the hip and pelvis. This is into the joint of the wrist. Now we find the hollow of the wrist on the other side. Rotate in, and we're now working on the ovary and the uterus. And we're going to place a link on this, so just lighten up and hold. Hold the link for a little while and then move on to working the fallopian reflex. Turn the hand over and you're going to work right the way around until you return to the point that you started at. Now, of course, with reflexology, when you're working the reproductive organs, the uterus is the prostate if you're working on a gentleman, the ovaries are the testes, and the fallopian that we're working on here is the vas deferens. It's just the same as it would be on the feet. These reflexes double up across the sexes. And again, because this is a line, we're repeating this 3 times. And we're next going to go on to work the sinuses. So we're going to do a squeeze, 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 all the way along the sinuses. We're turning over so you can have a look at this in greater detail. My fingers are all in line, and we're going to squeeze, 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 all the way up. Now with this finger we're going to click over the pituitary. So we're going to slide, slide, squeeze, 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 slide. Onto the index finger, squeezing up. I'll do this 3 times because it's a line. And the main pressure on this is really coming from my middle finger. As you can see, we're crossing over the index finger to get to the middle finger here. Change hands. I'm going to do these 2 fingers. Get a better image of my fingers making contact now. Do a last one. And now for the little fingers. And then we're going to turn the hand over. So we're now squeezing a supplier motion between forefinger and thumb on the side. And now on the palmar and dorsal surface. And then just flick off. So again the same. On the medial and lateral side, 3 times. Doesn't matter which way you do it, you can do it like this as well. Whichever you find easier. So 3 times, and then 3 times dorsal and palmar. On the 3rd time, squeeze off, so that you're flicking on the brain. And the idea of flicking on the brain is to just sort of stimulate it, get the cognitive elements working better. So squeezing again, and flick off. Squeeze, 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 again lateral and medial. Palmar and flick off. And by all means, do change hands whenever it gets comfortable for you. You don't have to keep with one hand all the time. And then ready to flick off. There we go. So finally we're going to roll over the brain. Remembering that the fingertips are also help reflexes for the brain. Roll over little finger. That's that. So we're going to now finish with closing relaxation for this side. Some cream on. Always warm up the cream on your hands before you apply it to your client. There's nothing worse on a cold day than cold cream being applied to your client's skin. I'm just going to rub the cream in. And you can see that I was going up the client's arm. As reflexologists, do remember we are insured to work up to the elbow when we're doing hand reflexology. So nice gentle, soothing sweeps. A bit of effleurage, and now we move into a bit of patrissage with the thumbs. Make sure that you've got oil all over both sides of the arm and the hands. So I'm going to wring the hand, and if I turn the hand over like this, you can see what I'm doing with my fingers. So the palm of the hand gets a lovely, lovely massage, but also the dorsal surface of the hand, as we can see now, is getting a good massage. And I'm using the thenar prominence of my thumbs to do that. I'm putting my little finger into my client's little finger between the thumb, and now we're going to make some circles. Lovely little circles. And we're going to do those all over the palm of the hand. This hold that we're doing stretches the hand really, really nice, so the palm of the hand is nice and taut, and it allows my thumbs to be able to get right into the flesh of the hand and give the most lovely, lovely massage. Now if your client's going, oh this is lovely, do more. If they're not enjoying it, a lot of people ask me, how long should I do something for? Well, if the client's enjoying it, do it for more. If they're not enjoying it so much, do it for less. Going to get back into some finger pulls, and we'll add some rotations onto these as we come off. Another pull, making sure you start right at the bottom, as far deep into the hand as you can go to extend that pull. Rotating the ring finger. And change hands now then, so we can get a long pull all the way up that little finger from the base of the hand. Now we're going to go into wrist rotations again, remembering not to actually hold the hand, just have your fingers interlocked so you can get full movement of that wrist. I'm going to wrap my fingers around, and we're just going to be able to have each finger wrapping around your client's finger, and then that will, here we go, can you see what I'm meaning about that? So each finger's wrapped around, and now we're just going to pull up. So all of the fingers have an individual pull. As a client, it's absolutely lovely. So we're going to now finish off by going back to where we started, with a heart to heart and with a stroke. And this side is done. So now we go to our client's left hand, put some cream on, and we'll tap before we apply it to our client, and spread it a little bit. And then we start with a heart to heart, just as a hold, light strokes. To do the finger pulls, remembering to get nice and low on the hand, so we've got the whole of the thenar prominence caught right from the base of the wrist through to the tip of the thumb. You can see if I turn the hand over just how far down we're actually starting with that thumb pull. Index finger pull. Long finger. Change hands. You can see I'm bridging across the little finger to do the ring finger. This allows me to get a deeper pull, and then a nice long pull on the little finger. So we're next going to do a wrist flexion. Remembering not to actually hold the hands, just with the fingers interlocked, so you can get that full rotation of movement. Now we're going to do press, so push in, squeeze off, push in, squeeze off. The squeeze off comes from my holding hand after we've pushed in with your fist. And then breaking chocolate, go from top down to bottom. We're going to do the same, breaking chocolate but the different way, using the thenar prominence of the thumb. And if I turn the hand over again, we can see just how the hand is completely ringed out by my hands. So we're going to tap to wake up the meridians. we're going to squeeze on the end of each meridian, little rotation as we squeeze. This wants to be quite a positive squeeze, nothing too dainty or delicate. I want to actually activate these meridian points. I'm going to tap right round the wrist, just as we did on the other hand. And now we're ready. So we're going to return to the left hand now and start with working the intercostal reflexes. We're working them 3 times per line. We go into the snow plough. Just imagine that you're pushing snow in front of you just like a snow plough would. And then you'll get the technique exactly right. And then we just automatically go into a wrist press from the snow plough. And then into wibbling between thumb and finger and up to the pain point. Put a circle onto that. And don't forget, this is contraindicated if you have pregnancy. Apart from that, it's great for getting rid of pain. So we're going to turn the hand over. Flatten the hand, so two fingers and these 2 fingers get a nice flat canvas, and we get to work on the trapezius. And again, because we're working in a line, we're going to do this 3 times. Nice little rotation as we push in. So now we're going to do the respiratory system, so the lungs. Again, remembering to use the lines on the hand as a guide, so you can see I'm just working down to this line, which represents the diaphragm line. And now we work onto the diaphragm itself, pulling back up towards myself. You'll be able to feel the heads of the metacarpals as you pull back up. You can see again that I'm using my thumb on my fingers with my working hand so that there's only one point of contact being felt. So we're just going to turn the hand up again now so that we can locate the stomach, the spleen. We're going to now do the pancreas. So now we know where these are, we can turn the hand back round again and get to work on the spleen. Now with the spleen, I like to work this with my knuckle. I want to energise this, make sure everything's in tip-top condition for your immune system. The stomach, and then the pancreas. And you can see that I'm just travelling round a little bit. So now the heart, remembering that the muscular area of the thenile prominence represents that huge muscle of the heart just nicely. I'm going to crisscross the area. And don't forget, of course, that the heart isn't just that physical pump. It's also our emotional centre. Having the hand flat like we are does enable us to get into the reflexes much, much easier. If you found that giving hand reflexology before you don't get responses, just try this, you might find the difference. We're now working on the adrenals and the kidney. And then we're going to follow the crease of the hand down the ureter to the bladder. I always like to work in the flow of direction, so if there's a flow, we want to follow that. So we're now going to locate our waistline guideline, so it's halfway between these 2 points and halfway between the first metacarpal, so that's our waistline guideline. Anything below this is going to be the small intestine, so now we're going to work this. It doesn't matter which way you work the small intestine. There is no particular flow with it as far as the hand reflexes are concerned, or the feet for that matter, because the small intestine goes up and down and left and right. So finally, we're now going to work the transverse colon. So starting under the thumb, working our way across the transverse colon, now down the descending, and then round the sigmoid flexure. So it's starting along, it's like an upside down J. So we go again, because of course we're working with the flow of the colon. Last thing you want to do is go and pushing anything that's in there the wrong way. And one last time. And again, if you wish, you can work this with your knuckle. So we're now going to do the spine. So remembering it's the grip for this with your holding hand is the handshake. Thumb fits really nicely between these. And as a reminder, we've got the cervical from that joint to this joint. So it's just there. We've got thoracic from these 2 joints. We've then got the lumbar from just there to halfway across the wrist. And then the rest is the sacrum and the coccyx. So, let's push in and then rock with your holding hand. The thumb of your working hand is just moved by that rocking underneath. So I'm pushing and rocking. And this allows you to create a C shape all around the bony edges of the hand, which means that we get right the way round the spinal reflex, rather than just working on one flat surface. So pushing in and rocking round. And then of course, when we get to the lumbar area, change that to working with the index finger. And one last time, because we're going to do this 3 times, being as it's a line. So we're now going to do some hook work on the spine. Remember that to get a really effective hooking technique with your finger, you want to pretend that that finger is like a sewing needle, and you're sewing through the skin onto the reflexes. You can either use your long finger like I am just here, or you can use your index finger. Use the one that's most comfortable. The more comfortable it is for you, the better the effect for the client. But do remember to hook in right on the tip of your finger. And now we're going to spread the spinal impulse using the fleshy part of my index finger. This is not supposed to be harsh or deep. This is just to spread the spinal impulse. So using an upward movement as we go across the lumbar and the sacrum and the coccyx. So of course we want to go across the spine with this, not along the spine. Turn the palm down, and now we're going to do the shoulder, and you're going to use the corner of the index knuckle again, so sweep up, nice sweeps, and then knuckle straight into the arm and leg reflexes, all the way down to the little hollow in the wrist. At any point, if you feel that the skin is getting a bit sticky, don't forget to put a little bit more lotion on if you need it. And we knuckle into the pelvic area, both sides, so you've got internal and external pelvis being worked at the same time. And then we put a rotation onto the ovary and uterus, and then link. Now we work across the fallopian. We're following the flow of direction with this, so we're going from the ovary to the uterus. Don't want to go pushing the egg back up the wrong way, so to speak. Because we're doing a line, we're going to do it 3 times. So we're working the sinuses. So we're going to start at the base of the thumb, squeeze, 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 and then a slide over the pituitary. Squeeze, 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 and then a slide onto the index finger. All of my fingers, predominantly my long finger, is putting the pressure onto the palmar surface of the sinuses. I'm going to take 2 fingers at the same time. So I'm going across the index finger of my client. I'm not actually squeezing on it anymore, I'm now squeezing on their long finger. This just makes it a nice easy way of being able to activate those reflexes. Swap hands. Now don't forget, with what I'm doing, I'm not holding the client's hand like this normally in a treatment. I'm just holding with the client's hand on the side so that you can see what I'm doing. The client's hand would normally be palm down, and you wouldn't be able to see what you're doing normally in a treatment like this. So now we're going to work the sinuses using the plier technique. Start with lateral and medial. Squeeze, 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 and then palmar and dorsal. And then finish off with a flick. Turn over for palmar and dorsal. Squeezing, squeezing, squeezing. When you flick off, it can sound just like you just clicked your fingers. It can sound quite impressive, and it's a really good way of stimulating the brain reflex. Turn over for palmar and plantar. Ring finger. One thing to remember when working sinuses, if you do have a client that does suffer from sinusitis, working hand reflexes can actually be even better than working feet reflexes, because of course the sinus reflexes are so large on the hands compared to that of the feet. So this is one of those occasions when hand reflexology can be so much better and more effective than foot reflexology. This is also the case with people that have got thyroid problems, as the thyroid reflex on the thumb is much larger than the thyroid reflex on the feet. Okay, so we're now going to do the brain. Remembering to do all the fingers as well, as these are helper reflexes for the brain. So we're going to prepare for closing relaxation. Warm the cream before we apply it to our client's skin. And with effleurage movements, we're spreading it up the arm. And we go into some petrissage with our thumbs. Turn the hand over and do the same again. So effleurage. And then a light petrissage. I want to work lightly on the underarm, being as we have got venous blood flow close to the surface of the skin under the arm here. It can be a little bit more tender than on the back of the arm. So turn the hand over. And we're going to wring the hand out, using a combination of penile prominence of the thumbs and my fingers underneath my client's hands. So turn the hand over, I'm going to interlock the little fingers, create a flat surface so that my thumbs can get nice and deep into the palm of the hand. And we do little circles all over our client's palm. Now nice big circles just to finish off these little circle section. So turn the hand over and we're going to prepare to do finger pulls and into a rotation. Extending this pull right from the base of the hand all the way to the tips of the fingers. Whenever it's comfortable for you, do feel free to change over hands. There's no rule about this, whatever is most comfortable for you. The more comfortable it is for you as a therapist, the better it'll be for the client. A lovely long pull now we can do for the little finger. So we're going to interlock our fingers. A lovely big movement in that wrist. Wrap the fingers round and then pull up. rotation, wrap the fingers round and pull up. In this way the whole of the hand, including all of the fingers, has been thoroughly relaxed. Bring the hand back down into a heart to heart and finish off with some strokes.